These friends of mine will come and go. I'm the first to leave and last to know. I'll be swimming in the face of flames. For these friends of mine I've overpaid. And I guess I want it, I guess I want it, I just want you to know. All of these things made me who I am. Maybe all of these things made me who I am. Maybe all of these things made me who I am, and I am. Only looking out with my head down. All of these things made me who I am. Maybe all of these things made me who I am. Maybe all of these things made me who I am, and I am. Only looking out with my head down. Veins are glistening. So thanks a lot for listening.
Dr. Leininger, in 1991, defined transcultural nursing as a comparative study of cultures to understand similarities, culture universal, and differences, the culture specific, across human groups.
We're going to start off by introducing the historical background for transcultural nursing theory, also known as culture care theory, by Madeline Leininger. We're going to start off by introducing the historical background for transcultural nursing theory, also known as culture care theory, by Madeline Leininger. Miss Leininger was initially a clinical child nurse specialist. The motivation for development of her theory was the desire to discover culture, their values, beliefs, and their needs. The idea for her theory came from her focused observation with her experiences with the children as she was in her role as a clinical child nurse specialist.
How could I provide any kind of relevant and meaningful and congruent care to these children unless I understood their cultural background? And then this is what led me into getting some background in the field of anthropology. I had found in giving care to people that care was so powerful. In 1942 and 48 for my diploma, and from private nursing. And these patients would always tell me, it was your care that made the difference. And that concept of care made the difference really was ingrained in me early. And that's when I started saying care is the essence of nursing, the heart of nursing. And, but then I thought, how can I tie culture and care together? And how could we begin to move from the foundation of an anthropological and cultural base into a nursing theory and a perspective? And so what it really meant, and this was the first clinical field that really focused on research to generate the knowledge, but to do that we had to prepare nurses to get some foundation of different cultures and then take them the next step into looking at it from a nursing perspective. The universality is not that universal about human care. All cultures do have care, generic and all. And there's still some cultures don't have professional care. You know, we're aware of that. So that it's going to take a while for us to identify some of the things that are going to be more universal.
The one-on-one observations Miss Lininger had with her frequent contacts with families from different cultures enabled her to see that the behaviors, needs, responses, and care expectations from every culture differed. The one-on-one observations Miss Lininger had with as she began to experience the needs of the many diverse cultures, Madeline Lininger realized that she was not prepared to care for these children.
The major concepts of the transcultural theory. The major concepts of the transcultural. The first concept is coping skills, as well as the social level of the patient. The first concept is cultural components is an important component of nursing. Culture influences all spheres of human life. It defines health, illness, and the search for relief from disease or distress. Religious and cultural knowledge is an important ingredient in healthcare. The health concepts held by many cultural groups may result in people choosing not to seek modern medical treatment procedures. Healthcare providers need to be flexible in the design of programs, policies, and services to meet the needs and concerns of the culturally diverse population groups that are likely to be encountered. Culture guides behavior into acceptable ways for the people in a specific group. As such, culture originates and develops within the social culture through interpersonal interaction.
Moving on to how the knowledge of cultural care theory can assist in your professional role development as not only a nurse, but in whatever profession you choose, because you will be contacting diverse cultures as you work throughout your lifetime. Moving on to how the knowledge of cultural care theory can assist in your professional role development. More specifically in nursing, we know that we need to be intentional about practicing nursing care to fit our patient's particular needs versus the traditional nursing practices or whatever needs we think that the patient needs. We know that's different, what they think they need and what we as the nurse think they need. And getting on the same track as the patient and being intentional about fulfilling their needs, we can see how our care will be shifted to fulfilling their needs, and our interventions will be more established in trying to tailor to the patient. As we continue in how this theory assists in professional role development, we know that when we shift our care from routine intervention and symptom management to care that is focused not only on what the patient is presenting with their symptoms, but we consider their mind, body, and spirit, we are opposing medical data alone, and we are actually practicing the art of nursing. Professional role development, how this theory can help the nurse develop in her role as a professional nurse is by implementing all these things. And it's not really all these things, it's one simple thing. It is keeping the patient at the center of your care. It is being culturally competent and sensitive. It is defining our expectations of health versus the expectations of the patient. We may think that their health level and establishing them as a healthy individual is different, obviously, in our mind versus their mind. So the way that we can use this theory to develop our role as nurses is to continue to provide care that is culturally appropriate, care that is safe, and care that's beneficial and patient-centered. This was not, before Madeline Lininger came along, cultural needs of patients was kind of something that wasn't thought about. Every patient pretty much got the same care, and I'm sure some patients thought it was great depending what culture they came from, and some patients thought, well, this isn't really fitting my needs or getting me back to health at all. So implementing this theory, allowing it to guide our practice is now going to help us develop as strong nurses practicing in our professional role. Professional role development.
Dr. Madeline Leininger developed the cultural care theory. The importance of this theory is that it assisted and opened a different care of nursing to a more diverse population of patients. Post-World War II, immigrants were coming to America. Many immigrants with different cultural backgrounds, beliefs, values, and needs required to be cared for. Dr. Leininger was not ready to properly care for this patient population, just like the rest of the United States. Because of the different backgrounds of this new patient population, she was driven to learn more about their culture, and she was motivated to develop the culture care theory. The importance of this theory is that it channels the nurse into different cultural beliefs and values of new people. One implication for nursing education is that the theory continues to be used in many schools in the United States and other countries such as Lebanon, Jordan, Saudi Arabia, Taiwan, China, Japan, and Finland. Healthcare professionals are becoming aware of how the transcultural nursing concepts can help in their field of work. The theory of culture care will remain a global interest for nurses and other healthcare experts who continue to explore cultures and their care needs and practices. An implication for nursing research is that in 2005, culture care theory was used to care for Syrian Muslims in the Midwestern United States. The purpose of the study was to discover, describe, and analyze the effects of worldview, cultural context, technology, religion, politics, education, and economic factors on the traditional Syrian Muslims' generic and professional care, beliefs, and practices. An implication for nursing practice is that the nurses and other healthcare providers can turn into actions and decisions that facilitate the provisions of cultural congruent care to traditional Syrian Muslims living in similar settings. The theory can be used to collect cultural data that can provide therapeutic outcomes.